Today we'll be talking about pancreatic cancer. Pancreatic cancer is a commonly diagnosed condition in the western part of the world. However, we also are seeing increasing number of cases in our practice. It is of utmost importance that these patients be diagnosed early and they be treated in setups which are routinely handling cases of pancreatic disease. Dr. Govil, what are the early signs and symptoms that a patient should watch out for in cases of pancreatic cancer?
Dear Vivek, regarding pancreatic cancer, there are symptoms which the patient should not ignore, like if the patient has significant pain in the upper abdomen, especially if it is going to the back, and also it is more on lying down and decreases on sitting down. That is a characteristic of a pancreatic pain. Plus, if he has a loss of weight and loss of appetite, those are the symptoms which are associated with cancer of the pancreas. And also if there is jaundice, that is yellowing of the eyes or yellowing of the urine or itching of the all over the body, or if the patient has some pale colored or whitish stools passing, all these indicate that there is some obstruction to the biliary flow and is indicative of probably a cancer in the biliary system and possibly pancreas. Also, another important thing is there are certain patients who develop diabetes suddenly, and a new onset diabetes is also a condition which is associated with pancreatic cancer.
So these conditions should raise a high index of suspicion. Dr. Govil, are there any high-risk factors or special groups of patients where one should specially keep a high index of suspicion for the development of pancreatic cancer?
Yes, I think there are patients like if there is a patient who's smoking for a long time, those are the patients who are at a high risk of this cancer. Plus, if there is a patient with diabetes, these are the patients who are at high risk of pancreatic cancer. And also if the patient has had history of pancreatitis, which is inflammation in the pancreas associated with upper abdominal pain, those are the patients who are at high risk of developing cancer. Plus also patients who are obese, they have a relatively high incidence of pancreatic cancer. And also in all these cancers, GI cancers, like these patients who have a family history of cancer of the GIT, they are the patients who are all at high risk of developing a pancreatic cancer.
So these would all be the special groups where one should definitely keep pancreatic cancer as a diagnosis in mind. What investigations are suggested to allow for an early diagnosis of pancreatic cancer?
I think important thing is we shouldn't be ignoring these symptoms. If there are any symptoms which I enumerated just now, we should go ahead with investigations, blood investigations, basic blood investigations like liver function test should be done, an ultrasound of the abdomen should be done. And I think we should have a low threshold to get a CT scan, because pancreas is not very well visualized on ultrasound and other investigations. So we should get a CT scan early, because an early diagnosis definitely would help in a proper treatment of these patients.
And ultrasound and CT scan, being non-invasive in nature, are also easier to get done and do not put the patient through much of discomfort. Dr. Govil, what are the treatment options that are available for these patients? And can these patients be treated at most setups which are performing surgical procedures?
Yes, I think these patients can be treated definitely, and surgery is the mainstay of treatment for these patients, because, and especially in an early detection is done, if early diagnosis is done in these patients, they can be treated surgically properly, although the surgery required is a complex surgery which should be done usually at centers which are routinely doing these procedures. Also, this requires a lot of infrastructure. So at centers where all the facilities and ICU amenities are available, these patients should be operated in such situations. So definitely these patients can be treated if they are diagnosed early and well in time.
Thank you, Dr. Govil. We will continue to bring more educative videos regarding GI cancers for both patients and doctors.